Hey everyone, it's Stephanie. Hi. I am going to be posting some video updates about everything that's going to be taking place next week with me going to the Mayo Clinic. I'm having a really hard time with my eyesight and letters being really blurry, so typing everything out has become a lot more difficult for me. So I decided I would try doing these video updates, and I hope they work for you guys, and I hope they work for me too. Anyways, as you guys could probably see behind me, and up there's my room number. I am, like I said in my post, I'm in the hospital. I'm at Virginia Mason right now. I am supposed to be leaving on Sunday, which is still the plan. However, I am having surgery tomorrow morning to put T-tubes in my ears because I'm having a really hard time hearing again, and most likely my hearing has dropped quite a bit since the last time I got tested, and so I've been working with my hospital doctor and the doctor who's supposed to be doing put the tubes in, and they've all agreed that as long as I'm stable, that tomorrow morning at I believe it's 10:30, I will be taken back and given some light sedation, and they will be able to put a tube in my right ear and possibly take the one that's in my left ear out and replace it with a new one, since it's been in there for a few years. It's good to replace them to make sure they keep working great. Right now, I'm still in the hospital because I still have severe stomach pain. As most of you know, I deal with some kind of stomach pain on a daily basis. However, this is crippling me. It's a lot of pressure and like sharp stabbing pain that I'm feeling, and it's throughout my whole stomach. And it is, it's kind of going hand in hand with me being extremely nauseous and throwing up and having a lot of bowel movements. It's not a pretty thing that's going on. Thankfully, though, my blood has come back up. My labs are looking better. We just don't know why all of a sudden I'm in so much pain, and we can't get these other symptoms under control. I had mentioned in my post that my doctor was looking into diagnosing me with ESS, and I can't remember what it stands for. The doctor told me today that those labs have come back, and she's thinking that I don't currently have it, but that it's something we need to keep an eye on. I do, however, she believes that I do have lateral cutaneous nerve syndrome or whatever. I don't have feeling on my right leg from my knee to my hip, but because of all this stomach pain, I'm not able to lift my leg up as much as I would when I walk, so I'm actually dragging my leg, which is really unsettling for me, and I'm not used to do that. So we're trying to figure out why that is. I have a lot of swelling that's happening in both my legs, though. Right now, it's like you touch like my leg and it's like as hard as a rock. So it's just kind of been frustrating to deal with. What else? I'm hopeful that maybe I will get to go home tomorrow night, Friday night. If not, it will be sometime during Saturday. My doctor is well aware that I have to get on a plane on Sunday. I'm stressing out a little bit because some of my doctors were supposed to write letters explaining, kind of my medical history and what they've done to help me, or what they've, tried to test so that I could bring that with me to Mayo. However, a couple of them have been falling through the cracks because my doctors have been, I guess, sick, or they haven't done it yet. And well, basically tomorrow's kind of my last day to really be able to get this information. I mean, I could pick it up on Saturday when I come for my infusions and to get my port accessed. And this is actually my port, you guys. When I talk about getting it accessed or de-accessed, it just means taking the needle out or putting it in. So right now it's accessed. I'm getting fluids. And so that's my lovely port. So yeah, you know, I'm hopeful that tomorrow, you know, I'll come back here to my room, recover from getting the tubes put in, which can sometimes really actually be painful for me afterwards. And it's usually really loud, which is kind of nice, but it also can like give me a really bad headache. So I'm hoping that, you know, things go smoothly, come back, relax. We'll wait for the drugs to wear off, the sedation drugs, and, you know, maybe possibly get to go home and have, you know, Saturday where I can, you know, still try to get everything I need to get done and pack and everything. So, you know, I'm hopeful that that will happen. I want to get a feel out there too, like, do you guys like these updates? Do you like me talking, I guess, to you or at you, however you want to view it? Or would you rather read it and not see my face or not see where I might be? Let me know. I'm you know, I want to do what might work best for the most people. So yeah, what else? I'm leaving, like I said, on Sunday for the Mayo Clinic. Thank you everyone who has supported me either by buying a shirt or donating money into the GoFundMe account or sending me a personal check. You guys have no idea how much this all means to me, and I'm so grateful to have you guys in my life to be able to help me when I need it. And like I said, the moment that I find out if I get charity care to help cover the bills is the moment I put a stop to everything, pay what I can, and if I still have money left over, either ask you guys what I should do with it. If you want me to redonate it to somebody else's cause, that's what I want to do. Or, you know, if somebody might need their money back if they're on hard times, I'd like to, you know, be able to do that also if it comes to that. So yeah, it is about time for me to get some of my meds, so I need to go before this gets too long. And I really hope you all are doing well, and I will probably do another update maybe before I leave or maybe when I'm at the airport. Once again, thank you so much for all the support you guys have given me, and I hope these videos can shed some light onto what I deal with on a daily basis, so you guys can actually see that, you know, I'm hooked up to these things all the time. It's a part of my life now. Anyways, have a good night, everybody, and sleep tight if you can get some sleep. See ya. Bye.